Hello, my name is Gilda Rubira, and I am in my last year to obtain my degree in physiotherapy at the Catholic University Santiago of Guayaquil. Today, I am going to talk to you about uh, effect of lower extremity sensory amplitude electrical stimulation on motor recovery and function after stroke, a pilot study. Well, like definition, a stroke is the leading cause of death and disability in several countries. More than 85% of patients suffers from hemiplegia and more than 69 from functional motor disability of the upper extremities. This impact generates an impact on the use of the upper extremity, eliminating the various activities of daily life of people. There are no studies combining electromyography biofeedback therapy and bimanual activation with functional electrical stimulation in subjects with sequelae of cerebrovascular accidents. Therefore, the interest is to determine the effect of a training protocol based on functional electrical stimulation with manual activation therapy and biofeedback on the function of the upper extremity.
Hack. A clot may occur within the brain, or it can travel from another part of the body. Commonly, the blood.
I'm sorry, I have a problem.
Hello, in this health sketch, we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini-stroke, or TIA. Often, symptoms only last a few minutes, but just like with a full-blown stroke, you must go to hospital immediately if you suspect a TIA. This is because a TIA is a warning sign that you're at high risk of having a full stroke. Whether you have a TIA or a full stroke, daily medications are started and continued lifelong to help prevent further episodes. The effects of a stroke can be disabling, but given time, the brain can slowly adapt to recover some previously lost abilities. This is why stroke rehabilitation is so important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support. We've talked a lot about strokes, but what can we do to prevent them from happening? Even if you've already had a stroke in the past, there are many small steps we can all take to reduce our future risk of having a stroke, such as lowering high blood pressure, the number one cause of stroke, stopping smoking, lowering cholesterol, being more active, eating healthily, lowering alcohol intake to within recommended limits. If you have diabetes, keeping good control of blood sugar levels. In this health sketch, we've talked about what a stroke is, how to spot the key symptoms, and the need to act fast. We've also talked about treatments, rehab, and the steps we can take to prevent strokes. We hope this health sketch about stroke has been helpful for you and those around you. Health sketch, health for all to see.
Um, this work, I'm sorry, this work is based on this scientific article, so the presentation of certain data will be based on said article. Application in physical therapy. Well, methods. This study is part of an ongoing double-blind randomized control trial. Inclusion criteria: admit to inpatient rehabilitation with first stroke, medical stable sensory and or motor dysfunction, and score 26 on the Montreal Cognitive Assessment score. The exclusion criteria: um, pre-morbid neurologic or balance disorders, and a project length of stay less than 6 days. The experimental group received SES, and control group received some stimulation over the peroneal nerve for 16 minutes daily prior to physical therapy. But intervention were provided 6 days a week throughout the rehabilitation stay. Subjects receive an average of 12 treatments. Outcome measures include the Fulmeyer, lower extremity sensory assessment, lower extremity motricity index, Berg balance score, gait speed, and the functional independence measure. In physical therapy, there are many approaches to drug rehabilitation. Your rehabilitation plan grew out of the body part or type of ability affected by this drug. Physical activities may include motor exercise. This exercise can help improve muscular strength and coordination. You may receive therapy to strengthen shadowing and mobility training. And this exercise can help improve muscular, mobility training. Perhaps you could learn to use mobility aids such as a walker, cans, a wheelchair, or an ankle brace. The ankle brace can stabilize and strengthen your ankle to help support your body weight as you relearn how to walk. Range of motion therapy. The certain exercise and treatments can relieve muscle tension, like a spasticity side, and help restore range of motion. Well, in technology assisted physical activities, like transmits, technology assisted physical activities might include functional electrical stimulation. Electrical is applied to weaken muscles, causing them to contract. Electrical stimulation can help retrain muscles. And the other transmits, robotic technology, robotic device can help injure limbs, perform repetitive movements so they can regain strength and function. Virtual reality, the use of video games and other computer-based therapies involves interacting with simulate and real-time environments. I'm sorry.
After a stroke, patients may no longer be able to correctly perform simple everyday movements, such as drinking from a glass. Drinking is still realized as a task, but the impulse sent from the brain is not sufficient to trigger the proper movement. This process can be practiced with functional electrical stimulation to improve motion sequences on a long-term basis. Drinking is realized as a task. Patients are thus motivated to perform the necessary movements. Motion strategies are planned, controlled, and adapted. The EMG function of the electrostimulator measures and enhances the patient's motion impulse to enable successful movement. Multi-channel electrical impulses support motion control. Successful learning depends on the patient actively starting the movement, repeating the movement, and using it in everyday life to obtain long-term success and increase their quality of life.
Pros and cons. Results: 44 patients were evaluated for 6 months. 3 patients complied inclusion criteria and agreed to participate. 2 females, one in control group and one in the experimental group, and a man in the control group were recruited with a mean age of 62.7 years, all with subcortical stroke. Subject 1 was 7 days post-stroke. Subject 2 and 3 were 5 days post-stroke. Subjects in both groups showed significant improvements in LEMI and BBS. Only 2 in Charles group showed a significant improvement in the FIM. Fulgmeyer was normal for everyone subjects at the beginning of the study. Gait speed could not be assessed due to the subject's inability to complete the test after the initial evaluation. The experimental subjects showed the greatest amounts of change in the LEMI compared to the control group. Issue applied in Ecuador. In Ecuador, they apply this treatment, but it's very little. I don't know, depending on this evaluation, you can choose between several methods of treatment, which vary from the traditional learning to perform, through that use the study of neurodevelopment, learning to perform movements, and the newest ones that work with musculus strength, the restriction of the healthy side. The electrical stimulation are designed to mix with each other. Everything will depend on the results of his assessment and the knowledge he has on the subject. And the conclusion, finally, the conclusion, due to the small sample size, the results cannot be generalized to all those who have had a stroke. Additional research and topics are needed to obtain a better understanding of how peripheral sensory stimulation can affect sensory recovery and functional gain after acute stroke. However, there are patients who have had a good response to this stimulus. Let us remember that its conclusion and results have been obtained from a scientific article.
Normally, the brain controls the muscles and our movements effortlessly. After a stroke, a part of the brain is damaged, and in many cases, the signals no longer reach the relevant limbs, and the muscles cannot move. Functional electrical stimulation, commonly called FES, is a remedy for this situation. Movement and walking becomes possible again. Stroke patients can now use this principle in everyday life. For example, when using MyGait. The device can be applied independently and with one hand. MyGait consists of 3 components: the heel switch, which is worn in a special sock, the cuff with the stimulator, and the remote control. When the person concerned lifts the foot, the heel switch sends a wireless signal to the stimulator. This activates the muscles that are responsible for lifting the foot as one takes a step forward. Thus, this person can walk actively again. ActiGait is based on the same principle, but it is less visible, smaller, and more comfortable to use. ActiGait consists of 4 components: a control unit, which is usually worn on a belt clip, an antenna, an implant that is inserted by the surgeon in the thigh, and a heel switch. When the person concerned lifts the foot, the heel switch sends a wireless signal to the control unit. The pulses are transmitted via an antenna to the implant. As a result, the excited nerve activates the muscles and walking can become faster or easier. George is happy that he has chosen MyGait, as he seldomly stumbles now, walks with confidence, and can meet his friends. A tingling sensation on the skin assures him that MyGait is stimulating his muscles. George is looking forward to daily gardening again. For further information, please visit
Well, it's all. Thanks for watching the whole video. Thank you for your attention, for your patience with my pronunciation. And it's all. Thank you so much and have a good day.